is Claire Steiner, and my research critique is on staff nursing sites of choice for administering IM injections to adult patients in the acute care setting. The problem identified, which led to this study, was that recent literature recommends the ventrogluteal site for IM injections, and instead of the dorsogluteal site. The dorsogluteal site is associated with potential sciatic nerve damage, and evidence to support this sciatic nerve damage, however, is lacking. And therefore, the purpose of the study was to determine which sites nurses were using for IM injections in the acute care setting, and to determine factors which are contributing to the site selection. So factors such as their age, years in nursing, education level, etc. There were 8 research questions in this article. I broke them down and combined them into 4. So the first is, what sites do practicing nurses most frequently use for administration of IM medications, and what's the rationale for the site selection? So what's the reason that they're using that site? Is it what they were taught in nursing school? Is it based on recent nursing literature, or are they just comfortable with said site? Next are, what complications do practicing nurses identify for the IM injection site that they're using most frequently? So do they know the complications associated with this site? And what complications, if any, out of these have they encountered? Next, is there a relationship between the site selection and selected demographic variables? We'll get to demographic variables later in the slides. However, demographic variables such as their age, their nursing education, and factors I listed earlier. Last, is there a relationship between site selection, known complications, and actual complications with this site? For the sample, this was convenient sampling. Nurses who consented to be contacted for research purposes when they renewed their nursing license were contacted for this study. In one Canadian province, all the hospitals in that province were contacted. There were a total of 652 questionnaires sent out to nurses, and the attrition rate was quite high. It was 57.8%. So only 264 questionnaires out of 652 were returned. There was no power analysis and no exclusion criteria, other than you had to be a nurse and volunteer for this study. The research design was descriptive correlation, so it's meant to describe the variables and examine the relationships among them. So examine the relationships among the variables such as age, education, years in nursing, frequency of IM injection, and that relationship to the sites being chosen for IM injections. Also, for the research design, this descriptive correlation can also be used to examine events that already occurred, which is what this research article was. It was nurses were sent a questionnaire and they were describing past events and things that had already occurred. For the results, the injection site choice was 71% chose the dorsogluteal site for injection, regardless of recent literature saying not to. Only 14% used the ventrogluteal site. I thought it was interesting that in their rationales for why they chose these sites, only 15.2% of nurses said they went by recent nursing literature, which is interesting because only 14% chose the ventrogluteal site, so maybe those are the same nurses who are reading the nursing literature and putting that into practice. The highest level of rationale was their own comfort with the site, so most nurses are just most comfortable with the dorsogluteal site. Their ease of mapping, easiest to find that site, and also what they were taught in nursing school. One interesting result was that 69.7% of nurses said that nerve damage was potential risk for ventrogluteal site, but this is not a risk for the ventrogluteal site, which is why it's recommended over the dorsogluteal site. Potential complications that nurses listed associated with their sites of choice were nerve damage and patient discomfort. Also, the actual complications that were encountered were generally patient discomfort and fibrosis, but there were no reports of any nerve damage even in the dorsogluteal sites. The impact of the demographic variables on this were quite significant. For age, it showed that younger nurses between 20 and 24 years old were more likely to use the ventral gluteal site. Older nurses were more likely to use the dorsogluteal site. For education, bachelorette-prepared nurses were more likely to use the ventral gluteal site. This could be because in the bachelor programs there is more emphasis put on research in nursing practice. Diploma-prepared nurses were more likely to use the dorsogluteal site, and again, because in the bachelor programs it's more emphasis on research in nursing practice, and the diploma programs may be more focused on just nursing care and the actual skills that you need. Years in nursing also was impacted this study, so selection of ventral gluteal site decreased with every number of years you were in nursing. So even those nurses 2024, it showed that after they had been nurses for more than 4 years, they began to resort and go to the back to the dorsogluteal site. So this is possibly that the younger nurses are coming out of college, bachelor prepared, and then they're working with older nurses who have been doing it for many years, and now they're just going by what they say and what their normal practice is. So limitations in this study were significant as well. The response rate was only 42.2%, so that's a large percentage of nurses that they didn't get an answer from, which could drastically change these results. Also, because it was convenient sampling, they only sent questionnaires to nurses who volunteered for research. So any nurse who didn't agree to be contacted for research purposes was automatically excluded from this study. It was a newly developed questionnaire which was sent to these nurses, and therefore, it hasn't been tested. This is the first set of nurses who have used this. It was self-reporting, and there was a potential for memory bias because these nurses were going off of past site selections. They weren't doing current site selections. Nursing implications are significant. It's really important for nurses to use evidence-based practice in the most recent nursing research when we're giving our care. Because as we know and we've been taught over and over again, nursing practice changes by the year because of nursing research. So an exploration into why nurses aren't using the current guidelines in the nursing literature is needed. We need to find out why, regardless of what nursing research is saying, they're still not following those guidelines. We need new research to explore the safety of a properly mapped dorsogluteal site. So even though there's a potential for a sciatic nerve damage, maybe if the site is mapped properly, there isn't that potential, and so that is needed to be known as well. And also advocates for the ventral gluteal site, they might need to start basing their rationales on more than just the potential for sciatic nerve damage, because as we saw in this study, there was no sciatic nerve damage, complication was not encountered, and one of the problems that led to this study showed that the research for sciatic nerve damage is lacking. And so maybe nurses are just thinking, well, this hasn't even been proven, so why am I going to change something I've always been doing? So that was it for nursing implications. In conclusion, nurses aren't using the current research for IM injections. Targeting groups for teaching, we want to target diploma-prepared nurses, nurses who are over 30 years old or have been nursing for more than 4 years. So even that 24 to 30 year range, if they've been nursing since they were 20, we need to target them as well so they don't change their practice. Teaching should focus on increasing the comfort level in the ventral gluteal site, appropriate mapping, correcting misconceptions about ventral gluteal potential complications, because as I said, a lot of nurses thought that there was nerve damage as a potential complication for the VG site, and there was not. Further research is also needed because there's a lack of actual data indicating that the dorsogluteal site is associated with a higher rate of complications, and so more research needs to be done to prove this. For references, I use my article by Walsh and Brophy and also our research book. And thank you very much.